Hello and welcome to this podcast from the Coalition for Life Course Immunisation, the CLCI. My name is Gary Finnegan. I'm a health journalist and editor of Vaccines Today. I'm also a trustee of the CLCI. This series delves into the role of life course immunisation in achieving global health goals at a time of ageing populations, climate change, geopolitical crises, and rising healthcare costs. And today we're joined by Jan Semenza of Umeå University in Sweden, and we're going to focus on climate change, infectious diseases, and vaccination policy in Europe and beyond. Welcome, Jan. Thanks so much for joining.
Thanks for having me.
Well, let's jump right in. So the link between climate change and infectious diseases maybe is something we didn't think about even just a few years ago. But you published a paper recently in Lancet Planetary Health on the spread of the tiger mosquito and the implications for Europe and diseases in the coming years and decades. Maybe first you'd just tell us very briefly about this mosquito and some of the diseases it can bring, and then tell us what your new paper has found.
Sure. So it turns out that this Asian tiger mosquito, or Aedes albopictus, is an invasive species. It's one of the most invasive species that we have seen. It has spread all over the world due to globalization. And Europe is no different. It was introduced into Genoa in the 90s and has spread throughout the Italian peninsula. And that is a concern because this particular mosquito has the ability to transmit viruses, tropical viruses such as dengue, chikungunya, or Zika viruses. And they are a huge public health issue because just for dengue, chikungunya, we're saying we see that something like 4 billion people in 129 people are at risk for these type of diseases. And Europe is at risk for these diseases also. And so we have in fact seen that this mosquito arrived in Italy, spread through the Italian peninsula, then moved into France and to Spain and Croatia, and it's now moving northward. So this is an issue because it can potentially transmit these diseases, and that's exactly what we have seen. We have seen that once the mosquito has arrived, then there is a likelihood that we'll see one of these outbreaks. And the bad news is that in the past, 20 years ago or so, 35 years ago, it took like 20 years between the arrival of the mosquito in an area and the first outbreak, arbovirus outbreak, so a dengue outbreak or chikungunya outbreak. And it turns out that that time span now has collapsed down to 5 years today. We have seen that this emergence of these infectious diseases is accelerated by climate change because if you look at warm districts, they're much more likely to have these type of outbreaks, these dengue or chikungunya outbreaks, compared to colder districts that are not as warm. And so that's why these mosquitoes proliferate because they're cold-blooded. They need to have a warmer climate. So we definitely see an increase in the likelihood of transmission in relationship to climate. So climate is a strong predictor of these type of outbreaks.
Okay, so some of those diseases, as you say, we always talk about them as tropical diseases that occur in other regions of the world. But now this is mainland Europe. It's not just Madeira and Reunion have had cases, and these are Europe. But we're talking about the continent of Europe. So if I understand correctly, it's not just that the climate is increasing the temperature and becoming more hospitable, but that the time to outbreaks is shorter. That's part of your finding. Is that right?
That's exactly right. So we can see that in the past, it took something like 12 years from the first outbreak to the second outbreak. If you look at a district that has experienced outbreaks, so it took like 12 years for the second outbreak to occur. But now it's just within 1 year time span between these type of outbreaks. And we see an exponential increase in number of cases. So we see more and more of these type of cases occur throughout the years. And in fact, it turns out that the number of districts that are impacted are also increasing exponentially. So we definitely see an expansion of these public health outbreaks that are of concern to all of us working in public health. And that is obviously something that we need to address from a policy perspective.
Okay, and are some of these outbreaks often in urban environments? I know a place like Brazil and Philippines, you get big dengue outbreaks, but often it's in stagnant water. It can be a breeding ground for the mosquito and so on. Are we talking about having outbreaks in in our cities all around Europe in the coming decades?
That's a great question because it turns out that in Europe we have this Asian tiger mosquito, and this particular mosquito is not an urban mosquito. We have the different mosquitoes, Aedes aegypti, which is the urban mosquito, and this mosquito drives outbreaks throughout the world. However, in Europe, excuse me, in Europe we have a different type of a mosquito, and this particular mosquito is not classified as an urban mosquito necessarily. However, in Europe, the situation is different. We have seen that 75% of these outbreaks do in fact occur in urban or semi-urban environment, despite the fact that we don't have Aegypti. We have the Asian tiger mosquito, and for whatever reason, in Europe, these urban environments are hospitable for this particular mosquito, and it can drive these type of outbreaks. So that is of concern. So the world the situation in different parts of the world is different because they have a different mosquito that's adapted to urban environments. In Europe, we have a different mosquito that now seem to be able to also support these kind of urban environments and drive those outbreaks.
Okay, and that Aedes aegypti that you mentioned is more of an urban mosquito. Is that likely to arrive eventually, or is it just not really suitable to Europe?
Good question. So it turns out that Aegypti did in fact exist in Europe in the 20s. There was a big dengue outbreaks in 1920 in Greece, for example.
Okay.
But then for whatever reason, it disappeared. And we don't really know whether it was competed out by different mosquitoes or eliminated through the malaria campaigns where they spray DDT and all that. But Aegypti does not exist in the continental part of Europe. It exists in other parts of Europe, but it has now recently been established on islands like Cyprus or Madeira, and so that is of concern. But currently on mainland Europe, we don't have that particular mosquito.
Okay, but we have plenty of problems to get on with, I suppose.
Yes.
And so when we look ahead, I mean, as I understand it, a lot of these projections have to be based on models and different scenarios. So, but with all of those caveats and health warnings, what kinds of timelines are we looking at when we think about, possibly frequent outbreaks of these diseases?
So that we have done exactly that. So we see this temperature relationship between these outbreaks and so the temperature relationship between the establishment of a mosquito and then these type of outbreaks. So we know, for example, that a 1% increase in the mean summer temperature leads to a 55% increase in the risk for these type of outbreaks. So now we can take that and project that forward in time on the climate change scenarios. And if we have a very moderate climate with emissions control and all that, we don't see that risk to go up dramatically. However, the track we are on currently is an extreme emission scenario, right? You have seen that emissions haven't gone down, and you see this dramatic increase in emissions and temperature as a result. And now we see a 5-fold increase in that risk by 2060 in the coming decades in relationship to these emissions that we are currently having in the world and that increased temperature. So it will get much worse.
Wow, okay. And as you say, unfortunately, there's no very promising sign that we're about to solve the climate challenge. So, under that scenario, as you said, we could have 5-fold increase by 2060. How well prepared are European health systems to deal with these diseases, the sheer number of them, and then even the actual treatments and other responses that would be needed?
Good question. So, obviously it's difficult to say, but what I can tell you is that, for example, there was an outbreak in 2010 of dengue in Croatia, and that outbreak was not picked up in Croatia. In fact, it was a German tourist who went home back to Germany and had these bizarre symptoms, and they were able to diagnose him with dengue. So they backtracked, went back to that area where he had been, and with the survey, they were able to detect a huge outbreak of dengue that was not picked up locally. So that means we are not prepared, right? Some countries pick up cases, like France has a very good surveillance system, and they're very good at picking up these cases. Cases have been picked up in Italy as well. But in other countries, we might not be as well prepared as France or Italy, for example. And that is of concern because if you don't know that there is an outbreak, you can't contain it, right? You need to be able to identify these cases, make sure these people get proper treatment, but don't get exposed to mosquitoes, because once they get exposed to mosquitoes, that drives the outbreak.
Okay, and just to understand how the disease spreads, so lots of the other infectious viruses we think of, we sneeze or we cough, but these are an infected person is bitten and then that mosquito passes the disease forward. Is that the typical transmission?
Yes, exactly. So the way that this works is that we have a global transportation system that allows people within 12 hours or so to arrive from a dengue or chikungunya active endemic areas in Thailand or Brazil, to arrive in Europe, let's say Rome, Milan, or Madrid, or some warm summer, an area that has a very conducive climatic environment for these mosquitoes. And so this viremic passenger arrives, and then the mosquito bites that individual, and the virus is in the blood. And the local mosquito then transmits that virus to another individual just next door. And that's where you have these local outbreaks. So we're not talking about imported cases, we're talking about local transmission. It's called autochthonous transmission, where local mosquitoes transmit that virus to a local individual that hasn't traveled. And so that's why we are concerned. And that's why these urban areas are at risk, because obviously they are connected to the global transportation network. And if you have a urban heat island effect, for example, where urban environments are extremely warm, the mosquitoes they thrive under those kind of climatic conditions, and then they pick up the virus and spread it to other people, and that's why we have these type of outbreaks in urban environments.
Okay, so the potential health cost and I suppose economic cost and health system cost will keep rising if the cases rise. So, what is the policy response to this on a public health side or in any other respect, apart from fixing climate change, which would be ideal?
Right. Of course, we need to address that issue, but at the same time, we also need to address these emerging public health concerns like dengue or chikungunya in Europe. And obviously, we can enhance our surveillance. For example, we can set up surveillance around airports where people arrive and make sure that people don't get exposed to mosquitoes locally. We can set up early warning systems that indicate that now we have conducive climatic conditions. We need to be particularly concerned about potential transmission. We have vaccine options where we can potentially deploy vaccines in outbreak settings, or even otherwise, if an area is at risk. There are lots of potential strategies we can take, but the thing we need to realize that is it's not just a public health issue, it's also an economic issue, because if we have an outbreak scenario in an area, we need to protect the blood banks, for example, right? And make sure that the blood banks don't get contaminated. We need to make sure that the tourist industry isn't affected, because if people suddenly hear that there's a big outbreak in Southern Europe, they don't want to go there. They might need to have a vaccine in order to go on vacation to Southern Europe. And those are not conducive conditions for the tourist industry either, right? So
Yeah.
it's something that needs to be contained both from a public health perspective, but also from an economic perspective.
Okay. I hadn't thought about the blood banks. Could you just explain more about what the impact for blood banks would be?
Exactly. So a lot of people go and donate blood, which we definitely need for obviously clinical reasons. However, if there is a West Nile fever outbreak in an area or a dengue fever outbreak in an area, it could be that an individual who is asymptomatic, they don't even notice that they have the viral infections. They go and donate blood to save other people's lives. And it could potentially be that that virus that's in their blood doesn't get picked up by the screening, and then potentially contaminates the entire blood bank and the blood distribution system, which could potentially have devastating health consequences for people that undergo surgery or need the blood supply for other reasons. And so this could potentially be a compounding problem for these individuals. And so it's something that we need to think of when it comes to public health.
Wow, yeah, I could immediately imagine the impact on just bed space in hospitals with people being sick during an outbreak, but this is a real systemic problem if the blood bank system is affected. Um, okay, so in terms of responses, you mentioned briefly that vaccination is one, small part of quite a complex response, and at the moment there are no vaccines for some of those conditions. There are for others, but generally we think of those as travel vaccines. Um, Do you ever envisage a situation where those would become more routine in certain areas if the disease was endemic, or is it more likely to be part of a crisis response where you're kind of vaccinating an area that has an outbreak?
So that's exactly right. So there's a dengue vaccine, there's a chikungunya vaccine, and those are administered to individuals that travel to Brazil or Thailand and other places where those diseases are endemic. And obviously, that's the right thing to do. However, do we need to consider these type of vaccines in Europe also? We are not there yet. However, just in October, there was a big outbreak of 213 cases of dengue in Italy, which was the biggest dengue outbreak to date. And these are just the cases that are being picked up. God knows how many asymptomatic cases there were. And if we see more and more of these type of outbreaks, people that might want to go to Southern Europe have to consider vaccination for these type of diseases if they want to protect themselves from these infections. So it's something that we need to think of, and we might have to change our policy response to the new normal, right? When these type of diseases become endemic in countries like Italy, that I call them part-time tropical diseases, right? The summer months are these days so hot that they resemble tropical environments, and the mosquitoes just love it.
Wow, okay. Interesting, if a little frightening. So yeah, part-time tropical diseases could become like a norm. Are they typically in the areas that these diseases are regularly seen, do they tend to follow seasonal cycles?
And that's correct. So basically, in tropical areas, you do see some seasonality to it, but it can be that that spreads out through all the seasons. However, in Europe, we have a much stronger seasonal pattern, and we have not seen outbreaks in the winter. So that's the good news, which means that importation has to reoccur before we have these recurrent outbreaks. So we don't have an endemic situations where we have transmission all year round. That is not going on in Europe. But obviously, we are concerned about that kind of a future if this continuing increase in temperature continues.
Okay. And for people watching this, I suppose maybe there's a sense that awareness is not very high of these conditions and even of the future risk associated between, climate change and health. But are there any things that individuals can do to protect themselves or even to help protect their communities when they go away or finding symptoms and reporting them? I mean, are there steps that they can take to help?
Absolutely. And so I'm glad you bring this up, right? Because we definitely need to make sure that if you go to an environment where we have local transmission of these type of tropical diseases, you need to avoid exposure to mosquitoes at all costs. So that means that you need to use repellents. DEET is a good repellent that keeps mosquitoes off your body. You might want to consider mosquito screens on the windows. And if you think about the state of Texas in the US and Mexico, it turns out that they're just adjacent, right? Adjacent, they have to share a border. And it turns out that the dengue incidence in Mexico is much higher compared to the dengue incidence in the US, because in the US, people use window screens, they have air conditioning, they sit in their cars that are air conditioned and don't get exposed to mosquitoes. Whereas on the other side of the border in Mexico, people get exposed to these mosquitoes and the incidence of dengue is much higher. So the take-home message is that we can do something about these type of tropical diseases by protecting ourselves from exposure. You do not want to get exposed to those mosquitoes. Don't risk getting bitten by a mosquito, particularly in the evening when you go out for dinner. Make sure you wear mosquito repellent and maybe be in an air-conditioned environment if you can to avoid that kind of exposure.
Okay. Okay, interesting. Well, and is it possible, and this is maybe an optimistic question, but given the contrast between Texas and Mexico, for example, is it possible that Europe will be better prepared if we take the right steps now for what might come compared to some of the really high outbreaks you see in Philippines and Brazil and places like that?
I hope so. Hopefully by eliminating standing water and taking care of our environment, that would definitely help. So this particular mosquito, the Asian tiger mosquito, breeds in artificial containers, like in flower pots and things like that. To make sure that we don't have any breeding environments around your house is absolutely crucial. But As I mentioned earlier, there was an outbreak of dengue in October 2024 in Italy. And I spoke with my Italian public health colleague, and he said that people were completely oblivious to the fact that the dengue outbreak was going on. So this is not on people's radar screen. But we have so many other issues to be concerned about, the war in Ukraine and Gaza, you name it, right? And then suddenly you have this local outbreak. It just doesn't register. And I think we need to change that kind of a communication to reach people, because we need to contain these outbreaks as quickly as we can to prevent the further spread.
And in terms of, public awareness of the climate challenge, do you think, in a way, because this is becoming more real and in the next decade or two could become a very salient issue, that this might actually help bring it home? Because climate change can seem so remote sometimes in our ordinary lives with other crises. But do you think as it impacts us and our health systems, it might inspire people to take more steps to fight climate change?
I wish I could tell you that I believe that. I
Yeah.
wish I could. Unfortunately, I don't. Just to give you a few facts, right? So in 2003, there was a massive heat wave in Europe that killed 70,000 people in Europe at the time. The Europeans learned from American experience that heat health action plans, where you go out and protect vulnerable individuals from these heat waves, can potentially save people's lives, and the heat-related mortality went down. Then in 2002, there was the hottest period ever recorded in Europe, and as a result, 61,000 people died in 2022. This is just like a couple of years ago.
Mm.
And I mean, this is inconceivable how many people died during that heat wave. That's like 300 airplanes of 200 people each that crashed, and nobody talks about it. It's like it's not being discussed. Then the next year, 2023, another very hot period, not as hot as 2022, but during that heat wave, 27,000 people died in excess deaths during that summer period due to the heat. So attributed to the heat. And again, nobody's talking about this. Nobody's discussing it. So I wish that these public health concerns would register with people, because the public health threat is considerable, and we need to address climate change for a lot of different reasons, not least from a public health perspective.
Okay. So maybe too soon for optimism. I think early in the pandemic, I remember thinking this will change attitudes forever and we'll have flu vaccination rates will be high and measles will be gone. But in fact, if anything, people have become they've either forgotten or else they've pushed it aside because they're fatigued by the whole idea of it. And maybe with climate, there's some of that fatigue coming too, perhaps.
Yeah.
Um,
I agree with you. And the thing that we are up against, I've worked on climate change for 30 years. I've been in the field for a long time.
mm,
But what you mentioned is one issue. The other issue is we have these vested interest groups like the fossil fuel industry that do not want to see any change. They want to keep pumping oil as much as they can, because that's what the profits come from, right? So we're up against a very formidable stakeholder who has a vested interest in pumping oil. Unfortunately, drill baby drill, as you know.
mm. And do you think if government awareness and policymaker awareness of this challenge, including the economic side of climate and health, do you think this could help, put more public investment into some of these measures, or even somehow disincentivize private finance from supporting, extractive industries, which still seem to put plenty of money into these really damaging enterprises?
So we definitely need this type of cost effectiveness analysis to show that an investment in this would save money and lives, and quantifying these type of benefits would be extremely beneficial. I totally agree. So we definitely need more research in this area to make that argument to policymakers that this is a win-win situation for everybody.
Well, to conclude then, what would be your top policy recommendations in terms of health, climate, immunization, and so on? What would be your take home given your experience and expertise in this area?
I wish that we would have evidence-based policy making as opposed policy-based evidence making, right? So somehow the whole thing has been turned upside down these days, where we are opposed to acting, and that's why we argue why we don't have to do anything, as opposed to looking at the evidence. And this paper that we discussed today is some of the evidence where the trend is. And if we can make evidence-based policymaking based on the facts as opposed to preconceived notions or vested interests, that will be the strategy to take. I work a lot on early warning systems because I do believe that if we can tell the public, listen, the risk in this particular area is of concern, protect yourself from mosquitoes or other public health risks, please take action. I think something can be done about along those lines. But again, we do need to have evidence-based policy making that looks at the facts and doesn't brush these issues under the table. For example, the tourist industry doesn't want to hear about outbreaks that could potentially threaten their bottom line, right? So we need to have evidence policy making to look at the facts and take the most appropriate steps, because that's the only thing that will reduce the risk for public health in the long run.
Okay, brilliant. Thank you so much. Let's leave it there for now, but we'll put a link to your paper in Lancet Planetary Health in the notes below this episode. But thank you very much for joining us, and thanks to everyone who listened and watched. Don't forget to subscribe and make sure you get the next episode, and you can look back at previous episodes in the videos section of the site. But for now, thank you all very much, and goodbye.